Good morning, Your Highness, Your Excellencies, distinguished guests. Thank you. It's great to be back in Doha. Also, congratulations to the fantastic winners of this year's award. Both of those individuals are incredible exemplars and work with organizations that we support. They're not only helping to educate the poorest in the world and give them hope, they're also helping us with the work we're doing to eradicate polio, where Pakistan and Afghanistan are the only two countries in the world that we've never gotten rid of the virus. So I'm excited to see them deserving this fantastic award. When I was in my 20s and 30s, I didn't think much about equity. I loved working on software. I was monomaniacal, working day and night. And I was thrilled that personal computers would be a form of empowerment. And that dream came true. I wasn't thinking at that time about global health. In fact, it wasn't until I was in my 40s that I realized that I don't even understand how many children die, what do they die of. As the world gets richer, are we helping children out? When I would visit Africa and other poor countries, I started to see how tough the conditions were and found that over 10 million children were dying before the age of 5. Many of them from diseases that vaccines existed for, but they weren't getting out to all the world's children. And so in seeing that, I said that the great fortune that I'm lucky to have from the success of Microsoft would go back to society to try to improve those lives and reduce those deaths. And I got to see firsthand the tragedy of a death from pneumonia or malaria. I got to see kids who are malnourished, and even if they survived, would never achieve their potential because they hadn't been fed properly at a young age. And so at the turn of the century, I created the Gates Foundation, and soon after that, it became my full-time work. And it's been incredible working with partners on all of this. Qatar, of course, is an incredibly generous country, not only in the role it plays in solving conflicts, but also its generosity in providing resources to these causes. So many groups have come together to achieve what I consider a miracle, which is that the number of children dying every year went from 10 million to below 5 million a year. It declined over twice as fast as it ever had in all of history. Part of that was getting vaccines out to those children, and a lot of it was supporting the primary health care systems to support those children. Unfortunately, this year marks the first reversal in this progress. Last year, 4.6 million children died. This year, it will be 4.8 million. And so we can think of lots of mothers who are facing this tragedy. But I'm also optimistic that we can stop this backsliding if we find the generosity both from individuals and governments, and we prioritize the basic, and we focus on the innovations that will help in this area. We can go back to reducing these deaths. Running a healthcare system with great primary health care requires less than $100 per person per year. And that's the system that can prevent over 95% of these deaths. The progress is fragile. We have not only very poor countries with over 600 million people living in them, we have over 100 million people living in countries with conflict. And we need to prioritize both of these. Now, fortunately, our innovation is going faster than ever. Thanks to great science, we will create new tools. We will have a vaccine for HIV and malaria. We will have the tools to end polio and make it the second disease ever eradicated. Now, artificial intelligence has come along to greatly accelerate our progress in these areas. AI will play a role not only in the scientific discovery side for new vaccines and drugs, but AI will play an incredible role in the delivery as well. We're funding the AI companies to understand all of the world's languages, including all the dialects of Africa and Asia. So even the poorest will, just with a cell phone, be able to talk and have a virtual doctor, a virtual tutor, a virtual agricultural advisor. In fact, our goal is very simple, that the poorest in the world should benefit first from AI, not be 10 or 20 years behind, which is normally the case. So even though we have this setback in child mortality, I am not at all pessimistic. In fact, I believe over this 20-year period, we can lift up countries and make almost all of them self-sufficient. I believe that if we do the right things, we can cut childhood death in half again, down to below 2%. Now, this is going to require a lot of prioritization. It's going to require a lot of partnerships. And today, the Gates Foundation is proud to be announcing a much expanded partnership with the Qatar Fund for Development. Together, we'll support economic empowerment, for example, farmers getting much better seeds and having double the productivity, as well as health and education. Qatar is a partner in some of the greatest efforts in the world, including Gavi, which buys vaccines, and Global Fund that works on HIV, TB, and malaria. There are regional initiatives that Qatar was one of the first to help drive, including the Lives and Livelihoods Fund. And so all of this early investment, this commitment to those in the greatest need is very exciting. So people should not be discouraged. Humans are problem solvers, and we can get these new tools. And this will be the generation that can solve childhood death. It can eradicate poverty, it can eradicate polio, and it can bring down over 95% diseases like malaria, HIV, and AIDS. We should not stop with the progress we've made. Together we can save the lives of millions of children and empower them to make great contributions. It's not going to be easy, but I believe this is morally the most important cause in the world, and we should work together to achieve it. Thank you.